Sudhindra. Thank you so much for making time today for joining Mishti podcast. As you know, we're trying to do these series to help senior citizens get more familiar with the medical system, get to understand specific specialities. And very quickly, if you can give a quick introduction about yourself and your specialty, that'd be great.
I'm Dr. Sudhindra. I work as a consultant pain physician at Bhagwan Mahavir Jain Hospital, Bangalore. Basically, I'm an anesthetist, but have trained in pain management in the UK, and I'm now settled down in this place to do what I can for patients.
Dr. Sudhindra, my very first question to you, because it's not very commonly known, what is pain management?
Pain management is a super specialty where your pain physician, someone like me, looks into the cause of the pain, and in specific cases where either a surgery or is not warranted or surgery is not possible, we do minimally invasive interventions like simple injections to give them pain relief so that they can engage in rehabilitation and get back on the path to recovery.
Understood. And in terms of, because our podcast is very focused to senior citizens, what type of pain-related issues do you often see in patients?
When we talk about senior citizens, mainly over 60, the most common pain conditions are sort of, you can classify them into two. One is the degenerative conditions like spinal pain, which is neck pain, upper back, low back pain.
Right.
And something called sciatica, that is the pain going down the leg, to a condition called slip disc, which is called in common parlance. That is the most common type of thing. The other pains are knee pains, hip pains, joint pains. This is the sort of degenerative condition, that is the wear and tear changes when they catch up with age. The other important painful conditions is cancer pain.
Right.
Obviously, when we live for long enough, some unfortunate minority of patients will develop cancer.
Right.
And cancer pain may be due to the cancer itself, the treatment, or the inability to treat the cancer.
I see.
So these are the sort of pains that
you commonly see among seniors.
In practice.
In terms of treatments, so let's just talk about sciatica and lower back pain. That seems to be quite an common phenomenon with seniors. What are the symptoms that would manifest if somebody does have slip disc or sciatica? What are the symptoms?
See, our spine is made up of two main structures: bones, which are like bricks stacked on each other, one another, and between these bones there's something called an intervertebral disc, which is like a small shock absorber.
Right.
Okay. As we age, the small shock absorber in between the two bones can crack, and some material can spill onto the nerves that are supplying the legs or the arms, depending on where the slip disc happens. And patients can have low back neck pain or pain going down like electric shock like pain either on their leg or arms. So this is the pain due to an intervertebral disc prolapse.
Okay.
So what happens is from a patient perspective, so this is what we need to know, that when such a thing happens, it is important for them to visit a pain physician or a spine surgeon to see what is the sort of treatment that they would need.
Right.
But the good news is that most of the slip discs, more than 90 to 95% of the slip discs are self-resolving.
Okay.
That is, they resolve over time in 6 to 8 weeks.
Okay.
But having said that, it is important to visit a doctor and get themselves thoroughly checked so that they don't end up with a long-lasting disability.
Got it. And another question that comes quite commonly with seniors is varicose veins. Is that something that can be treated with pain management?
Varicose veins can cause pain. To answer your question, varicose veins is a condition where the veins are not able to pump back blood towards the heart.
Okay.
The veins have valves which are helpful in unidirectional flow of blood.
Right.
It's like a one-way traffic back to the heart.
Right.
With age, the valves can become incompetent, and
Okay.
also certain risk factors with jobs where there's excessive standing at one place and stuff like that. This can cause pain, definitely. We do manage those pains.
Right.
But having said that, our pain management in such a situation would only be symptom-based and not at the root cause.
Right.
The treatment for that is very minimally invasive, safe, and routinely perform surgeries. That would be the
right way
to go.
Deal with
While you are waiting for that, we can definitely manage pain effectively.
Understood. And in terms of pain, when you're dealing with cancer patients, unfortunately, there would be a cohort that may come under that category. What are the typical treatments that you provide for managing pain in such patients?
So, cancer pain, there are mainly two main modalities of cancer pain treatment. One is called the medications, the other one is the interventions.
Okay.
This would be the core types of pain management. Having said that, there are other modalities like physiotherapy, counseling, psychological support, and a lot of spiritual well-being as well. So coming to the core things, the medications, the main core medication would be what are called opioids. Like the morphines and the fentanyls that would be mainly used to get the pain quickly under control.
Yeah.
Obviously, there is a lot of fear about these opioids.
Yeah.
But in cancer pain, with effective guidance, they can be used extremely well.
Yeah.
And to give the patient his or her quality of life for the small period of time they are going to live.
Okay.
On the other hand, we also do a lot of interventions, that is minimally invasive daycare procedures to sort of get the pain quick. For patients for whom we are not able to control the pain with opioids, these interventions help A, to get the pain down quickly, and B, to make those pains more responsive to the opioid therapy.
Understood.
The total sort of aim is to get the pain down to a reasonable level, so that the patient can live comfortably during their last days.
Understood. And just switching gears to very quickly on knees, we were just talking before the podcast, you mentioned in certain cases, because even when you do a knee transplant, those knees have sort of a lifetime of 15 years, you try and avoid or at least delay that to as late as possible. Oftentimes the surgeon would recommend they come to you in terms of managing the pain. So maybe you can just briefly talk about people who might be considering a knee replacement and primarily because of a lot of pain that they're experiencing. What are the options there?
Osteoarthritis of knee, that is the wear and tear in the knee, is one of the most common causes for performing what is called the total knee replacement.
Right.
And this is one of the most successful surgeries which gives patients back their quality of life enormously.
Right.
Having said that, there are a certain cohort of patients who A, are either too young for a knee replacement, or B, unfit to undergo a knee replacement. In these cases, we do help them with very minimally invasive injections in and around the knee, which can A, help them manage their pain, B, at least postpone their surgery for some time. The other places where we help the surgeons is a very small percentage, maybe less than 1 or 2% of people who have knee replacements continue to have some pain.
I see.
Most of them have very good pain relief, but they do suffer from pain. There's a very small minority of them. We do help them with injections as well to get them back on the road to recovery.
Got it. Understood. I think those are all the questions I have for you, Dr. Sudhindra.
Thank you so
Really
much.
appreciate your time.